Welcome back. Well, no secret, the genetically blessed often go to the head of the line. While looks aren't everything and won't compensate for the lack of ability forever, looking better and a bit more attractive might help. Meet Dr. David Kim, former chief of facial plastic and reconstructive surgery at UC Medical School. He is now in private practice in San Francisco. Dr. Kim, welcome. Nice to have you here.
Thank you, Susan.
Okay, I'm sitting here thinking, what does he want to do to me? All right. Can a facelift land a job?
Well, it's not that simple. Facelift, of course, isn't going to automatically make somebody a shoo-in. Your last guest made a great point that employers don't want negative people around the office. And a facelift or other procedures that can make someone feel and look better will translate into how they think about themselves, which will translate into how they present themselves.
So it's the confidence that comes from having it done, perhaps?
It's the confidence, and it's sort of that added X factor that gives somebody an edge over somebody else. I'm not trying to make people feel and look better because their employer prefers a higher eyebrow or prefers a jawline that's better. That's not the person that I have to please. I have to please the patient. And if the patient can feel better and more confident, these are intangible things that translate into how they interact with the world.
But with the current situation in terms of the job market, which is almost, I mean, it's grim,
Yeah,
okay?
absolutely.
And there are a lot of people who are, you know, 40s, 50s, and older who now have to stay in there. They thought they were going to retire, and now they're not.
Absolutely.
Are you seeing a lot of people coming there and saying, you know what, Doc, I need an edge here, help me?
You know, there's a tension between the economy because people don't have as much disposable funds.
That's right, it costs money.
But there's also the other side that they want to have an advantage over the other folks that they're competing against. And you know, I didn't make the world. The world is a little bit of a cruel place.
Yes.
And people make judgments, and there is ageism, and there are unfair judgments made on people. These are things that can make people just look a little more natural, a little more refreshed. And as I said, just give them a little better self-esteem.
Well, less tired. I mean, a lot of people who are, you know, getting up there of a certain age, they want, you know, something done here. And, you know, the eyes, you know, remember Greta Van Susteren, and she went on, everybody said, oh, she looks arrested. She went on, and they said, oh, she had her eyes done, okay.
Yeah.
Is that the procedure, would you say, or is it the jowls? What's the one, if somebody came in and said, I don't have a lot of money, I can do one thing, but I want to give myself a fresher, more rested, at least, look?
Yeah, well, you know, to explain that, you should know a little bit about how the face ages with time. You know, science.
Well, it all falls. Let's go to what we have to do.
It does. It deflates and comes down. So a facelift is sort of the flagship procedure. It covers the most territory over the face. The jawline starts to drop, and you lose this nice shadowing. You lose the angle of the neck where the skin kind of sags. These folds deepen. The tissue on the eyes and the brows come down. And if all of that tissue can be repositioned into a more youthful position, it can take years off your life. 10
Yeah,
years,
but if I
15
can only
years.
do one thing, if I can only do, because aren't people doing more piecemeal stuff now, even with Botox and all
They
that?
are.
But I mean, they're saying, don't do my whole, because nobody wants to look like they were in a wind tunnel. Because this is kind of a, this isn't in anymore, is it?
Well, it's not in. You know, you don't want to look done. You don't want to advertise to the world that you've had a facelift.
Oh, she's been, you know, pulled within an inch of her life.
So if you have a lot of things going on and there's one thing that you're going to pick, if your eyes are really heavy, an eyelid lift. It's a 1-hour procedure. You know, the eyes are the window to the soul. The eyes are the window to the interview.
Right.
And this is where you're engaging someone.
Exactly. What does it cost? What's the rough ballpark figure in San Francisco?
You know, the range varies place to place, but probably $2,500 to $5,000.
And this is not covered usually by insurance.
Well, if the upper eyelid skin sags so far down that you can't see, you know, then but you have to make it. You have to get a medical exam, and it can be a tough case to
Now,
be made.
the standards really of beauty have changed. There's something, I forget what it's called. Da Vinci did it. He figured out, there's a word for it, wasn't there?
These are the canons of facial beauty. So Da Vinci, even from the ancient Greeks, had these measurements, these angles that they used to say this is the blueprint or the guideline.
And if it's off a little bit, it makes a difference between being beautiful and not so beautiful.
Well, that was the thought. And that's even taught now in modern medicine. You know, the plastic surgery textbooks have these angles. You know, the angle of the nose has to be a certain number of degrees. You know, I don't really try to follow that type of a guideline. We conducted a study while I was at the university which tried to look at these different measurements in different ethnicities, and we found that you couldn't hold true to any of these firm, rigid guidelines.
They say, for instance, Angelina Jolie's lips would be considered too big, right?
Would be considered much too big. And,
Tell that to Brad Pitt.
That's right. That's right. Well, I think he's pretty happy. So, you know, it's very much ethnic differences, and really the bottom line is that you have to cater your treatment to the preferences of the patient. What fits that person. We talked about unnatural appearances. They have to fit everything. Their ethnicity, their family features, and most of all, their goals.
Don't you think, I mean, I don't know, this is just an opinion or maybe an insight or maybe it's just me. that Americans get so obsessed with the kind of the Miss America pageant. I mean, the whole beauty culture. Everything's got to be perfect and beautiful. And you see even young girls. I mean, you see the anorexia nonsense going, and they don't like this and they hate that. And size 0 is great, which I always wonder, do the clothes come into the room before the body? I mean, how's that work? Are we ever going to get over that?
It's a pervasive problem. You see folks who come into the office with unrealistic expectations, and my job as a surgeon is also to be a counselor. And if I feel like I cannot make that person happy with the procedure that I'm going to perform, it's off the table. I can't go forward.
Okay.
If I feel like I can, then it's something we can talk about. It's a difficult problem, a deeply rooted problem.
I hate to ask this, you do take credit cards, don't you? Sure. Yeah, I mean, they do now. And Susie Orman says, don't use them, but maybe for this you need to use them and then live on Melba Toast for the month. Okay, Dr. Tim Kim, we thank you for being here. And for more information, you can go to Dr. Kim or you can talk to him on actually he has his website there, okay, and that is
dwkimmd.com.
Okay, there it is, and his office is on Post Street. Consultation's free?
That's right.
Okay, all right. He'll only do it if it really works.